7.1 million Americans enrolled in Obamacare, said President Obama today, praising the achievement of overcoming lost weeks during the blundered rollout. The president says the law has not fixed the health care system, but it has made it a lot better. He admits, though, there is still more work to be done.
It's also true that despite this law, millions of Americans remain uncovered, in part because governors in some states, for political reasons, have deliberately refused to expand coverage under this law. But we're going to work on them, and we'll work to get more Americans covered with each passing year.
Michigan is not one of those states. Today is the first day to enroll in the Medicaid expansion in Michigan. People in Grand Rapids were lined up at 9 o'clock this morning to sign up. You've got a lot of questions about the new program, and tonight 24-hour News 8's Heather Walker is live with everything that you need to know. Heather?
Yeah, right now, the whole idea behind this is to provide health care coverage for people who don't have it. And I've just learned that as of 11:30 today, close to 2,000 people have already been approved across the state. What's the most common question?
I think the most common question is probably, I've applied for Medicaid before, will I be denied again? This is a totally new program, so even if you have been denied Medicaid before, definitely try again. This is expanding greatly the number of people who will qualify.
To qualify, you must be 19 to 64 years old and earn up to 133% of the federal poverty line. For a single person, that's about $16,000 a year. For a family of 4, it's $33,000. If you meet the requirements, you can apply in 3 different places: online, over the phone, or in person at any federally qualified health center, including Cherry Street Health Services. And what do people need to bring?
People need to bring just your basic date of birth, social security number, so your IDs, as well as any income, proof of income that you have. That could be a W-2, that could be, your tax return, paychecks.
You also need information on any current insurance. The process should take about 45 minutes to an hour. Coverage starts the first day of the month you apply. What's the cost? It depends. There's set copays for services ranging from $1 to $50. You could also be required to pay 2% of your income, depending on how much you make. Now, there's no deadline, but the sooner you enroll, the sooner you can get coverage. We have all this information and more posted at woodtv.com. Live in Grand Rapids, Heather Walker, 24-hour News 8.